Hello, I'm Marissa Schaefer.
And I'm Jenna Cantor, and welcome to Physiotherapy Performance Perspectives, a physical therapy podcast for performing artists.
Today, we are at the International Association of Dance Medicine and Sciences annual conference in Houston, Texas, interviewing Dr. Lindsay Harmon-Matthews. So welcome.
Hello, how are you guys?
Great. So good. Happy to have you here.
Thanks, I'm glad to be here.
So, Lindsay is a physical therapist in Ohio. She received her doctorate of physical therapy at Ohio University, after which she went on to participate in a Dance Medicine Practicum in New York City. She has her master's in public health from OSU and is a board-certified specialist in orthopedic physical therapy. Lindsay has been a dancer from a young age and has continued her interest in dance medicine and science as a physical therapist. Currently, she's a PT and team lead for OSU's Werner Medical Center Ambulatory Rehab. She is also a member of the Performing Arts Medicine team at OSU. She coordinates dance medicine research for the PAM team, or the Performing Arts Medicine team, has authored studies on turnout, plié range of motion, balance, and dance injuries, and has presented at international conferences.
Today, Lindsay is here to talk about her research, which she presented here at IADMS. Dance-related musculoskeletal complaints presenting to a walk-in clinic during summer dance intensives. Let's go for it.
All right. So because we usually ask for our presenters to talk as if they're talking to their patients, our first question is, can you talk about what a musculoskeletal complaint is?
Sure. This is a question that is particularly important in dance medicine research. And to answer this question, we need to first discuss the definition of an injury. So dance medicine literature reports injury incidence rates that vary from 37% to 87%. And the reason for that wide range in variation is because we often define injuries differently in the dance medicine literature. So that makes it really difficult for us to compare studies, right? So if I ask each of you, have you ever had an injury before? Marissa might say, yeah, there was that one time when I rolled my ankle in class and it hurt for weeks and I was injured. And someone else might say, I don't really think so. I rolled my ankle, but I kept dancing and I didn't see a physical therapist. I didn't see a physician. So Jenna might say, no, I've never had an injury. And so we have then very different definitions of what an injury is. So IADMS actually had a standard measures consensus initiative put together. And this initiative published in 2012 a paper in the Journal of Dance Medicine and Science that put out these definitions, these common definitions for us to use so that we all have a common starting place to compare our research and to be on the same page about what we're saying and what we're talking about in research. So the Standard Measures Consensus Initiative recommended that an injury is defined as a problem that causes a dancer to miss one full day of dance or more. Now you can imagine, though, that not all problems that dancers encounter are captured in this definition, right? So many of us,
right through.
Exactly. We keep dancing through these problems, through these musculoskeletal injuries. So then we need a way to define these problems that do not meet that definition of injury. So if you're not missing a full day of participation, we define this as a musculoskeletal complaint. So long answer to get to the answer of your question, but a musculoskeletal complaint is a musculoskeletal problem, soft tissue issue that may be causing us pain, but we're not missing a full day of dance participation due to that problem.
Well said.
Yeah.
All right, so can you tell us a little bit about your research?
Sure. First of all, need to thank my co-authors for this study.
Yes.
We have a team of performing arts medicine clinicians at Ohio State University, and these include athletic trainers and physical therapists and physicians, so our team is really great, and this research wouldn't be possible without them. My co-authors are Samantha Amway, a physical therapist, and Tiffany Maruli, who's also a physical therapist, and she directs our physical therapy fellowship in performing arts medicine at Ohio State.
Who we welcome to come interview with us anytime.
Yes, I'm sure she'd love to. And Dr. Timothy Hewitt is a PhD researcher at Mayo, and he was also part of this study. So many thanks to them for this research.
Absolutely.
So this research was actually part of a larger study that our institutional review board approved. And this larger study included examining results of both dance wellness screens and injury evaluation sessions. Our Performing Arts Medicine program works closely with a local dance academy during their summer intensive program. So at the beginning of the summer intensive, we perform a musculoskeletal screen with the dancers. We're measuring range of motion, strength via manual muscle testing, balance, flexibility. And so our initial research questions involved looking at trends in this screen data. We wanted to do this for a couple of reasons. We wanted to improve the education that we were offering to the dancers. They all get individualized recommendations based on their screen results, and we wanted to study the trends and improve the information we were able to give them. But we also wanted to understand what the normative mean values were for our dancer patient populations. The second part of this study, the broader study, was correlating the screen information with data from injury evaluation sessions that we do on site at this summer dance intensive. So we wanted to understand if there was any relationship between the screen information that the dancers have and whether or not they're presenting to our on-site clinic for musculoskeletal complaints or for injuries. So our clinic is on site at the summer intensive, and the dancers can sign up to have their complaints evaluated. We're there 3 days a week, and they can come in for 20-minute evaluation sessions. The purpose of this smaller study then was to determine the types and frequencies of complaints that dancers are coming into the clinic to have assessed. So we really wanted to understand why are they coming to us, and then secondarily, how are we treating, how are we addressing those complaints that they have.
Nice. So just to be clear, so every dancer gets a screen,
Every dancer gets a screen.
but not every dancer comes in and gets an injury eval.
Correct,
Yeah,
correct.
okay.
About 32% of the dancers who participated in our study came into the clinic for assessment of some sort.
Gotcha. Okay, cool. So what made you decide to conduct this research?
Well, we had a couple of reasons. First of all, we wanted to perform some program evaluation and improvement. So the more information we have about how we're doing and why dancers are coming to us, the more we can improve the services that we're offering our dancers. But knowledge is power, right? We wanted to ultimately be able to help our patients keep dancers healthy so they can continue to do what they love. So understanding the nature and the types of dancers' complaints can help us be more impactful with the prevention strategies that we're offering to dancers. For example, if we want to offer a dance wellness workshop, we want to make sure it's addressing a body region that is relevant to the greatest number of dancers possible. If only 2 dancers in a summer intensive have neck pain, for example, offering a workshop on preventing neck pain is not going to be as relevant to every single person.
For dancers who are listening in, would you mind explaining how does this research benefit the dance community in more detail?
Absolutely. The more we understand trends in injuries and in musculoskeletal complaints in the dance community, the more we can work together to prevent those problems from occurring. Some sports have guidelines about activity levels and dosing these activity levels, right? So, for example, in baseball, there's a pitch count. So at a certain age, as a pitcher, there's a specific number of pitches that you are supposed to safely be able to throw in a game. Dance does not necessarily have these specific guidelines at this particular time. There's been more and more work to understand the intrinsic and the extrinsic risk factors for injuries. So as we know more, we can do more to mitigate risk and to decrease injury risk.
Absolutely. So what type of musculoskeletal complaints did you come across in your summer?
So in the summer dance intensive, the complaints aligned really strongly with the rest of the dance medicine literature. 86% of the clinic encounters were at the lower extremity, and this is what the rest of the dance medicine literature shows, of course. 50% of the complaints were at the foot and ankle, mostly being at the ankle at 36%. About 10% were at the hip, and about 10% were at the knee.
Excellent. I like to hear that what you learned is just supporting the evidence that's already available. So it's just really helping the dance medical field become a little bit stronger with our evidence.
Yeah.
Definitely. We can all help validate what is already known out there.
Yeah.
Absolutely.
So did you find that most complaints resolved quickly after examination and treatment?
So anecdotally, I can give you a little bit of information. I can give you some information from the study as well. The answer to that particular question is a little bit beyond the scope of this study. We didn't follow them long term. But I can tell you that only 4% of dancers in this study missed 1 or more days of dance. So most of them were those true musculoskeletal complaints, not those time loss injuries. So it was really good to see that those dancers were able, for the most part, to continue participation in their summer intensive. Sometimes modifications were given as a treatment technique to help dancers be able to safely continue participation. This provided some relative rest or some unloading of that healing area so that they could continue to participate.
Brilliant.
Awesome. So what advice would you give a dancer regarding when to see a healthcare practitioner, like in the face of a musculoskeletal complaint?
Well, first of all, there are some situations, of course, that require more immediate medical attention, right? Those medical emergencies, those chest pain, shortness of breath, those things all require urgent and immediate 911 or medical attention. Beyond that, we have acute injuries, and then we have injuries that do not have a particular mechanism or a known mechanism of injury. So with an acute injury, if you have swelling or high pain levels, or if you have difficulty weight bearing or difficulty moving a body part, those would require more immediate medical attention. So those would be people that I would absolutely encourage right away to see their physical therapist or their physician or their athletic trainer. But for those that don't have that identifiable mechanism of injury, think about whether or not your daily activities are impacted. Sometimes we have dancers who come in and say, okay, I rolled my ankle, when can I get back to class? So we have to first talk about, are you able to walk comfortably and without a limp? Are you able to go up and down stairs? If the answer to those questions is no, then we need to get you back to daily activities before we can think about getting you back quickly to those dance activities. So if those are issues for you, I definitely encourage you to get in to see your medical professional sooner rather than later. If it's more of an ache or a pain, monitor over a couple of days. Something that's an ache or a muscle soreness will peak in about 24 to 48 hours, and then will get better, improve, and go away. But if there's no improvement in a couple of days, try some relative rest. Avoid those aggravating activities. It should get better in a couple of days. If not, then reach out to your physical therapist, athletic trainer, physician. But I'd also encourage any dancers who have questions about whether or not they can be doing more to help something resolve, or if they're healthfully participating in their activity, to reach out to their physical therapist.
Absolutely.
We can always provide that assessment, especially those of us who are passionate about dance medicine. We have some additional knowledge and training about dance and the biomechanical movements involved in it. So we're always happy to help and provide additional information to dancers.
I think those were super clear guidelines, so thank you.
Hashtag choose PT.
Hashtag choose PT.
Right.
Just a quick question. So you talked
Sure.
about acute injuries and a clear mechanism of injury versus not a clear mechanism of injury. So by mechanism of injury, you just mean like an event that happened, right?
Right. So something that's acute with a clear mechanism of injury means that you know exactly when that injury happened. You were maybe traveling across the floor and thought, oh gosh, I just tweaked something. What happened? Something hurts. That would be a clear mechanism of injury. Something without a clear mechanism of injury is that ache or pain that crops up and you have no idea what you did to cause it. You can't think of anything that caused that injury.
Cool. Thank you.
Excellent. All right, last question. My favorite. So please, Lindsay, tell us your favorite story of when you treated a dancer.
Oh, so many to choose from. I love working with dancers. It's so energizing. I really like when I get to see someone be excited about achieving their full potential, particularly if they have had some doubts about whether or not they'd be able to get back on stage. I met a dancer early in her high school dancing years who had been to multiple healthcare providers and had had pain for a long time. And she was unsure about whether or not she'd be able to continue dancing. She had actually stopped dancing for several months by the time I saw her because she had just had pain for so long that was unresolved. And we worked together for quite a while, many months, and were able to get to the bottom of what was causing her pain and work on improving some technique issues and strengthening the area and getting her ready to get back in the classroom, and she was able to get back to dancing. Awesome. That was just such an exciting moment, and I had the opportunity to see her perform, and it was just really touching and meaningful to both of us and to her family that had been involved in this journey. So it was really exciting.
My eyes are literally welling up a little thinking about that. That's beautiful.
Well, thank you for sharing that, and thank you for sharing your knowledge and your your literature, everything.
Thank you for having me. I've enjoyed talking to you both, and I'd encourage any dancers out there or PT students or professionals to reach out, make connections, keep learning, keep growing. That first step, it can often be the first step in a really great journey in your career. So it's sounds a little cliche sometimes, but great things really do happen when we work together. So make those connections and collaborate.
Yep. Absolutely. And as always, we want to thank our listeners for joining us for another episode of Physiotherapy Performance Perspectives. Join us on the first Monday of every month for the next episode.
To hear more of our episodes, click on the link in the description below to view our website. Like us on Facebook at facebook.com/PT Performance Perspectives to stay informed. And finally, if you want to get in touch, email us at ptperformanceperspectives@gmail.com. Thank you so much.
Thanks.
Thank you.
Bye.
Bye.
Bye-bye.